This is a CJASN podcast, and I'm Olszewski, a pediatric resident at Seattle Children's Hospital.
I'm Deborah Stein, a pediatric nephrologist at Boston Children's Hospital.
And I'm Traci Wolbrink, a pediatric intensivist at Boston Children's Hospital and co-director of Open Pediatrics.
We're here to talk about our recent publication in CJASN about a resource in global nephrology education, the Virtual Peritoneal Dialysis Simulator, which is accessible free of charge at www.openpediatrics.org. Across the world, there are great disparities in access to educational resources for healthcare providers, contributing to inequalities in healthcare outcomes. Given the importance of peritoneal dialysis worldwide, especially with its high use in regions where training is less readily available, we developed a globally accessible, standalone educational resource to teach pediatric peritoneal dialysis. The simulator includes an interactive knowledge guide, brief case-based problems, and longer virtual cases that simulate clinical scenarios across a hospitalization. The learner virtually diagnoses conditions, manipulates the peritoneal dialysis setup, adjusts the prescription, and administers medications based on changing clinical assessment, fluid balance, and laboratory results.
The simulator was accessed by 1,066 users in 70 countries from January 2016 through October 2017. Users included trainees and experienced nurses, physicians, and other healthcare professionals. There was a statistically significant mean increase of 36% between pre- and post-test scores for the 300 users that completed the structured curriculum, suggesting knowledge acquisition from the simulator. On average, users spent an hour using the simulator, with those who completed the entire simulator spending almost 3 hours, suggesting interest, engagement, and motivation for self-directed learning. The majority of respondents to a survey were satisfied with the simulator, felt it was relevant to their clinical practice, up to date, and reflects current best practice and evidence, and would recommend it to others.
We have shown that it is possible to share resources to healthcare providers and trainees globally across resource settings, disciplines, and training levels. We would like to thank the Clinical Journal of the American Society of Nephrology for this opportunity to share the peritoneal dialysis simulator, and we look forward to feedback about how we can make this and other nephrology educational resources more useful. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.